Okay, so the first exercise I have for this patient is a calf stretch. Dorsiflexion less than 8 degrees puts this patient at the risk for higher falls. It'll make it difficult for them to clear their foot during the gait cycle and may lead to shorter steps or a slower gait speed, or the potential for lateral shifting during the gait cycle. So for this calf stretch, you can use a towel, which I have here, letting your foot up like that, leaning forward until you feel a stretch in your calf. If that's too hard, you can just lean forward, even holding against the wall since this patient has balance issues, and just till you feel a stretch in that calf, and you're holding 30 seconds. This is going to be done 5 times a week. To make it a little harder, this towel can be rolled up to be higher, or roll another towel into it, and that just creates a greater angle. And again, holding that stretch for 30 seconds, maybe even move it up to a minute, 3 times a day, 5 times a week. The second exercise is going to be sit to stand. This patient has weak hip extensors and a score in the 30-second sit to stand that puts him at pre-frail or frail, depending on other factors. That's a score less than 8, which he's a 7. Muscular endurance should improve his sit to stand score and possibly help his endurance during the 2-minute walk test if muscular endurance is the limiting factor. So the sit to stand will be performed 3 times a week with 48 hours in between each exercise session, so he has time to recover, and 3 sets of 15 each time he does the exercise. 15 because that's in that endurance range. And so I have here a chair set up, and so he's going to do 3 sets of 15, and I would recommend having something in front of him. He's doing this at home just in case he needs to grab on. To make it a little easier, if he's having trouble with the activation of his muscles, he can add a pillow, maybe a little thicker than this, so that he's at a higher stop, better length tension relationship, and he can do his 3 sets of 15 that way. Or if 15 is too much for him with his endurance right now, he can start at 3 sets of 10, work his way up. To make it a little harder, he can just do taps so that his muscles are engaged the whole